Hello everyone, it's Neil from singlebestanswer.com. We're your go-to revision resource to help you pass the UK MLA or the PLAB exam. Today I'm going to go through another question for you, and it's a little bit tricky because it requires a bit of data interpretation, but we'll try and get through it together. So we're talking about a 73-year-old woman today with back pain, and she reports some weight loss over the past 6 months. She's been admitted twice for a chest infection, and she does not have any urinary or bowel symptoms. She is exquisitely tender over the lumbar spine, so that may give you a clue. Otherwise, there's no focal neurology. Breast examination normal, chest clear, and abdomen is unremarkable. So we're going to go through some options here, and first of all, I'd like you to think what sort of pathology is underlying her presentation, and I hope the most standout thing is malignancy because of the weight loss and the musculoskeletal pain. So we're thinking some sort of malignancy, and in terms of the investigations and the data here, we're looking for something that would stand out in a particular type of malignancy. So it's a little bit tricky because you've got to take a couple of steps forward to think your way through as to the most likely diagnosis. But if I told you that we're thinking of a hematological malignancy, then you'd get some clues with regards to the calcium levels. You would expect hypercalcemia. In many malignancies related to bony metastases, but in particular myeloma, you would expect a very high calcium and a high ESR. So in this case, we are going to go for D, which is raised calcium and raised ESR, and that's relating to myeloma, which would fit with the patient's presentation. Let us go through the other options briefly to see whether we can explain these options and whether there's a better answer out there. So A is low vitamin D and reduced bone density. Well, we'd only really see that in osteoporosis with vitamin D deficiency. What about B? Low serum calcium, a raised PTH, normal ESR. Well, with malignancy, we'd expect a raised ESR most of the time. Low calcium and raised PTH, you can get that in vitamin D deficiency, of course, where the PTH is trying to compensate for the low calcium. And what about C? Normal calcium and raised alp phos. Well, you get that in particular in a condition called Paget's disease of the bone. That's to do with an abnormal metabolic turnover of bone, and that's typically the picture you get in Paget's. And what about E? Raised calcium and a raised PTH. Well, that of course refers to primary hyperparathyroidism, in which you get both raised calcium and raised PTH. Okay, so we're going to go with D, which is raised calcium, raised ESR, in keeping with myeloma, which is the correct answer. And I hope you really enjoyed that question. Come back for more, subscribe to the channel. We'll be releasing videos regularly. Head over to singlebestanswer.com for more of these questions and to help you pass your exams. Good luck, and I'll see you next time.